Hi there, welcome to Finlayson Family Chiropractic. My name is Dr. Chris, this is Anetta, and today we're going to be going over a few different exercises to help with your spinal correction. So the first things we're going to be showing you guys today are the neck and the low back rolls. So if you've gone through the entire exam and we've prescribed you neck and low back rolls, use these videos as guides. The purpose of these rolls is to create proper posture and curvatures in your spine so your spine can stay healthy. So the first thing we're going to have Anetta do today, she's going to demonstrate a few things so I can kind of walk around and discuss, is we're going to start today with a low back roll. So the low back roll, Anetta, I'm going to have you sit here and kick your legs this direction. When you place this low back roll, and again, this is only if we've told you to do this, if we've prescribed this for you, is the best option is to find the bottom part of your rib and draw a line all the way to the back of your spine. So it shouldn't be down here in her low back. Sometimes that's going to cause some pain and tenderness. So for her, Anetta, can you find the bottom of your rib there? So if I drew a line right to her low back here, she can even reach back and hold that for me. So go ahead and hold that. And I want you to lay all the way back onto your back so that it's easier to set the low back roll and then bring your feet up on the table for me. It's also important to bring your legs up on the table. It helps create those curvatures. So now that you can see, if I take the bottom of her rib right there and I place that low back roll, that's placed, that's not going anywhere. So it's a lot easier to do this first before you set the neck roll, because once you're set here, you don't want to shift it around. So with the neck roll, a lot of people, if you've gone through the exam and you have been told maybe your head has gone forward, or it's more extreme and you have a reverse curve, we want to place this neck roll right here behind your spine to draw this curvature back in. The goal is that you're going to be able to lay on this for about 20 minutes. Now we're not going to start there, but the ultimate goal is to be able to lay on these rolls for up to 20 minutes. And you're going to do this after you've done some other exercises. So before you do these rolls, you're going to do this wobble cushion, which is meant for the low back, and you're also going to do this band, which is going to be put behind your neck, and I'm going to show you a series of exercises in another video on how to do this. And those two things are done before you do this roll, okay? So let's pretend she's already done her exercises, and now she's going to lay on the rolls so she can start to mold her spine. So in this position, I'm going to hand you this roll. All I'm going to have her do is lift your head up for me and tuck it underneath your neck. Yep. And it should roll right to the base of her shoulders. And when she lays her head back, perfect, go ahead and lay the head back there and relax. You can see it's below her ears, so her ears should be above, and it's above her shoulders here. Now everyone's going to be different. Some people have reverse curvatures that are lower, some that are higher. So just remember that I might give you a more particular way to do this. But just from a very general standpoint, this is how I want most people to be set up. So in this position, she's just going to relax. Again, this is after she's done her exercises and warmed her spine up. What I prefer is when someone comes in for their exam and we tell them this is the thing they should be doing, start at 5 minutes. So when you go home your first day and you have your rolls and you have the kit, if you're moving forward with the corrective care plan, go home that first day, only do 5 minutes, always set an alarm. A big problem I see with people is they'll go home and they're all gung-ho to get started, and they'll start 20 minutes the first day. And a lot of times that can cause headaches, that can cause tension, that can cause pain in the neck. So there's no reason to try and push this. You can't correct a spine fast. It's going to take time. So my recommendation is start at 5 minutes with a timer. When that timer is done, it goes off, you're done for the day. If that felt fine, no pain, no issues with that, the next day set it at 10 minutes. And if 10 minutes is fine, the next day you can do 15 and then so forth to 20. Once you hit 20, you can start to move with 20 and 25 minutes, and I want that daily. So every day, I prefer the evening after your exercises, you're going to lay on these rolls just like this, relax, let the body do its job. It'll start to mold and change the curvature. Again, what we're trying to do, you have to imagine if her neck was reversed or in this direction, we're trying to curve it back over that fulcrum. So her neck right here, you probably feel a little bit of a pull on your neck, right? Because we're drawing that curve back in. So along with the neck roll and the low back roll, these are done at night. And I typically have people, you can do these in the morning or at night. I prefer people do them at night typically because it's a 20-minute process, and if anybody's anything like me, I wake up and I like to get the heck out of my house. Most people are not gonna set their alarm 20 minutes early. I just know how we work. So I just prefer this to be done at night. You can relax. It's a 20-minute process it's done after your wobble cushion, right? This always happens before your rolls. Before you mold on the rolls, you always have to exercise. And again, these are coming soon. And so the molding in the evening is with the rolls, but the molding in the morning is different. We're actually going to do I call it a head hang, where your head hangs off the edge of the bed. You got to be very careful. I'll kind of explain how we do it. But again, just like the low back rolls, you always do the wobble cushion and the prolordotic neck band before you neck roll and before you head hang. It's very, very important. It's just priming your body, priming your discs, priming your spine to actually take that mold. Again, we're trying to take forward head posture necks and reverse curves, and we're trying to draw them back to a normal spine. And if you've gone through the exam process and the doctor's report, you probably know why we're doing that. We're trying to bring function back to the spine so that that nervous system can function optimally. So let's show the head hang here. So the scenario here is it's the morning. She's already done her band work with the neck band, which that video is coming soon, as well as the wobble cushion to warm up the low back. So she's already warmed up. She's already done her exercises. Now it's the morning time. She's gonna let her head hang over. This is only a 5-minute exercise. I'm not gonna make you wake up 30 minutes early. So in the morning, now she's gonna scooch her head back towards the edge of the bed. So right here is fine. Start right at this point where just the end of her head is hanging off. Her whole head's not whipped down all the way over the edge. Start here first and kind of feel out what it feels like. It shouldn't be sharp. It shouldn't cause tingling. It shouldn't make you feel dizzy or nauseous. If anything, it should just be a little bit tight here in the front. Besides that, it should not be too uncomfortable. And if it is, stop, come ask me, and I'll kind of set you up with something different. So at this point, let's just say she gives it 10, 15, 20 seconds. It's not bothering you? You feel good? Okay. So she's going to inch back about 1 inch. And yeah, just like give the worm a little bit. There we go. And you'll notice every inch that you go back, you'll be really surprised at how much more your head hangs. So don't make a whole foot of movement with your body, or else your whole head will be off. So does that feel okay? You can notice we're getting a wider gap here. Her neck's starting to curl over. Her head's now falling back a few inches down. If that feels fine, let's add a few more. So add another inch in, right? Now, there we go, even a little bit more. There we go. So now you can see her whole head is pretty much falling off the edge of that bed. So what we're doing is we're trying to open up the anterior longitudinal ligament in the front, open up the musculature, draw that head back and extend it. Because again, we're fighting that forward head posture. If she can, and feel it out, give this one about a minute. If you can go back about 1 more inch. Right, so you scoot back about 1 more for me. This way. Go this way. Yep. 1 more inch. There we go. So now her shoulders are at the end of the bed here, and you can see huge fulcrum in the neck, so we're really opening that neck. And what I want is this position in the morning, ultimately only for 5 minutes. So work your way up. So just like the neck roll where you start at 5 minutes and work your way up to 20, this you start your way up at 1 minute to 2, 3, you work your way to 5. Let's just say she's 3 minutes in right now. She has her phone, the timer is about to go off, and she looks at her phone. There's 3 minutes on, 2 minutes left, but she's really uncomfortable. There's no reason to push it. I don't want any sort of pain or discomfort. So, but instead of just stopping, what we'll have her do is just scoot back an inch or so. So now she scoots in a little bit and takes a little bit of pressure off her neck. And if you still want a little bit more, if it's still not enough, come back another inch. Just like that. So now she just has a little bit of traction. It's not quite as extreme. Once that timer goes back down to 0, so let's say now the timer's off, it's been 5 minutes. So before you just whip up quickly, I don't want you in that position and jumping up, blood rushes to your head. I don't want you to stumble or fall or pass out or anything. So scooch, even before you come up, come back down. Even scooch a little bit further this way. There we go, a little bit more. To where you're actually almost back to neutral. And then kind of rock your head side to side, right? So go ahead and rotate side to side. And just to make sure the blood's back into the body, the blood's where it belongs. And then what I want you to do is come up nice and slow, and turn and face the camera this direction. So once you come up in this position, sometimes after 5 minutes of letting your head hang off the edge of the bed, you'll notice the blood sometimes rushes back into the body. So when you're in this position, you'll look left, look right, look up to the ceiling, look down, left ear to the shoulder, right ear to the shoulder. You can stand up, hop off the bed, and go on about your day. So just a quick reiteration here. Morning and afternoon, or morning and evening, you always do the neck bands, the wobble cushion. In the morning, after you do the exercises, you hang the head off the bed. In the afternoon, you do those exercises again, but you use the rolls. So it's pretty simple. And again, we're trying to strengthen, exercise, and then actually make change and mold that spine. And again, this is for most of the people here who are actually following along the corrective care program. Thanks for watching. If you have any questions, let me know. Take care.